Hello, my name is Ana Alvarez Haynes. Today, I will be presenting a health lesson brought to you by the American Heart Association. The topic is blood pressure. What is it and how can you control it? The American Heart Association has been investing in supporting life-saving heart-brain research for over 100 years, from contributing to the development of the pacemaker to advancing imaging techniques such as MRI and CT scans to creating the CPR and AED guidelines. Their mission is to be a relentless force for a world of longer, healthier lives. Heart disease is the leading cause of death in the US, even greater than cancer. The good news is that there's a lot we can do to prevent or treat it. One of the most important steps is checking your blood pressure. If it is high, learning how to manage it can make a big difference. The whole body is connected and works together like a team. Your heart, kidneys, and the way the body creates and uses energy, metabolic health, have different jobs, but together they affect your overall health. A new concept for how your heart, kidneys, and metabolic system connect and share work is called cardiovascular kidney metabolic health, or CKM health. CKM health is about your overall health and taking action early to prevent a heart attack, heart failure, or stroke. The American Heart Association is leading the way in helping people understand and manage their overall health by focusing on the whole person, not just one disease at a time. When one area of your health isn't working well, it can hurt other areas. For example, high blood pressure can harm the heart, raising the risk of heart attack and stroke. High blood pressure can damage the kidneys over time, potentially leading to chronic kidney disease. High blood pressure often occurs with diabetes and obesity, commonly making CKM health problems worse together. Most people don't know how closely these problems are connected. That's why the American Heart Association is working to teach everyone how to protect all three systems together to improve overall health and lower the risk of heart disease or stroke. Today, you will learn what high blood pressure is, how it impacts your health, the causes, how to manage it, and a next step action plan. The lesson should take about 15-20 minutes. Feel free to take pictures of any of the slides. Do you know someone with high blood pressure? Why are we concerned about blood pressure? A lot of people think that high blood pressure is a problem for older adults, but almost 1 in 4 young adults, ages 18 to 39, have high blood pressure. One thing to remember is that high blood pressure does not usually have symptoms. That is why it is called the silent killer. So people might have high blood pressure and not even know it. High blood pressure is one of the most common health problems. There are things you can do to change it. The reason this is so important is because when left untreated, high blood pressure can lead to heart disease, heart failure, atrial fibrillation, stroke, dementia, chronic kidney disease, vision loss, and sexual dysfunction, such as erectile dysfunction in men and lower sex drive in women. This is why it's so important to check your blood pressure often. If you have high blood pressure, learning how to manage it can save your life. Reinforce the learning by asking, what are the 2 numbers you need to know when you measure your blood pressure? The top number, systolic, the pressure in the arteries when the heart pumps. The bottom number, diastolic, the pressure in the arteries when the heart relaxes between beats. First, let's define high blood pressure. When your heart beats, it pumps blood into your blood vessels. This creates pressure against the blood vessel walls. This blood pressure causes your blood to flow to all parts of your body. High blood pressure, also known as hypertension, is when your blood pressure is consistently too high. What's most important to understand is that high blood pressure can lead to health problems, including heart disease and stroke. Your blood pressure is recorded as 2 numbers. The top number is called systolic blood pressure. It shows how much pressure your blood pushes against your artery walls when the heart beats. In this picture, the systolic pressure is 110 millimeters of mercury. The bottom number is called diastolic pressure. It shows how much pressure your blood is pushing against your artery walls while the heart is resting between beats. In the same picture, the diastolic pressure is 67 millimeters of mercury. If you are asked the difference between arteries and veins, arteries are blood vessels that carry bright red, oxygen-rich blood away from the heart to nourish all parts of the body. Veins are blood vessels that carry oxygen-depleted, bluish blood towards the heart. What are some things that you can't change that will impact your blood pressure? Family history, age, sex, race, and chronic kidney disease. All these things can increase your risk of high blood pressure. Even though you can't change any of these factors, there are important things to know. One of the key points I want to highlight is family history. Not everyone is comfortable talking to their family about health issues, but it can save your life. So the next time you talk to your family, make sure you make health a top priority. What are some things that you can control that might affect your blood pressure? Here's a list of the things that are in your control. These are known as manageable risk factors because people have the power to make these changes. Avoid alcohol. Avoid or limit alcohol to less than 1 drink daily for women and less than 2 drinks daily for men. Cigarette smoking and exposure to secondhand smoke. Black licorice. Some anti-inflammatory drugs, for example, NSAIDs such as ibuprofen, herbal supplements such as St. John's wort, recreational drugs. Limit caffeine. Avoid more than 1 cup daily in patients with severe uncontrolled high blood pressure. Acetaminophen, such as Tylenol, to less than 4 grams per day. Decongestants. Use for shortest duration possible in avoiding severe or uncontrolled high blood pressure. Manage diabetes, being obese or overweight, high cholesterol, unhealthy diet, being physically inactive. Think about the things you see on the list and how they relate to your life. The important thing to remember is that you can improve these things. These are the updated American Heart Association blood pressure categories. Normal blood pressure is less than 120 for the systolic or top number and less than 80 for the diastolic or bottom number. Elevated blood pressure is between 120 to 129 for the systolic or top number and less than 80 for the diastolic or bottom number. Stage 1 high blood pressure or hypertension is now 130 to 139 systolic or the top number, or 80 to 89 diastolic or bottom number. Stage 2 high blood pressure is 140 or higher for the systolic or top number, or 90 or higher for the diastolic or bottom number. Severe high blood pressure or hypertension is anything higher than 180 for the systolic or top number and or higher than 120 for the diastolic or bottom number. If you don't have symptoms, you should call your healthcare professional. For anything higher than 180 for systolic and higher than 120 for diastolic, that includes symptoms such as chest pain, shortness of breath, back pain, numbness, weakness, change in vision, or difficulty speaking, you need to call 911 immediately. Please take a picture of this chart so that you have it with you at all times and can use it as a reference. If you have high blood pressure, home monitoring can help your healthcare professional determine whether treatments are working. Monitoring your blood pressure at home can be done by buying or renting a blood pressure cuff, using it correctly and tracking the numbers. Blood pressure monitors can be purchased in most pharmacies and online. In adults, the use of cuffless blood pressure devices is not recommended for the diagnosis or management of high blood pressure. An automatic cuff style, bicep, or upper arm monitor is recommended. There is a right and wrong way to measure your blood pressure at home. First, 30 minutes before your blood pressure is taken, make sure not to smoke, not to exercise, no caffeinated beverages, and no alcohol. Second, while you prepare to take your blood pressure, rest for at least 5 minutes. Don't talk. Rest your arm comfortably in a flat surface at heart level. Sit upright, back straight and supported. Keep legs uncrossed and feet flat on the floor. Use a validated device. The bottom of the cuff needs to be above the bend of the elbow. Wrap the cuff against your bare skin, not over clothing. Reliance on cuffless devices, including smartwatches, for accurate blood pressure measurements should be avoided until these devices demonstrate greater precision and reliability. Partnering with your healthcare professional is the best way to reach your treatment goals and enjoy the benefits of better health. When it comes to medication, it is important to keep in mind you may need to take medication every day for the rest of your life. Tracking your medication and taking it as prescribed. You may need more than one type of prescription medication. Be aware of how certain over-the-counter or OTC medications, such as decongestants, may affect your blood pressure. Understanding possible side effects of medications and talking to your healthcare professional about any concerns or questions you have. When was the last time you saw your healthcare professional? Is it time to make an appointment? Again, don't answer this question out loud, but it is important to think about these things. Sometimes people may feel they don't have time, but making your health a priority is important. Your health is connected to your loved ones and to doing things you enjoy. A low blood pressure reading is usually good. Some people with a very low blood pressure have a condition called hypotension. This occurs when blood pressure is less than 90/60. Low blood pressure is usually not harmful, unless there are other symptoms that concern a healthcare professional. Constantly low blood pressure can be dangerous if it causes signs and symptoms such as confusion, dizziness, nausea, fainting, fatigue, neck or back pain, headache, blurred vision, heart palpitations, or feelings that your heart is skipping a beat, fluttering, or beating too hard or too fast. Low blood pressure can happen with prolonged bed rest, prolonged standing, depression, Parkinson's disease, pregnancy, dehydration. Certain medications and substances can cause low blood pressure, heart problems, endocrine problems, nutritional deficiencies. If you notice a sudden decline in blood pressure, one reading that is lower than normal, you shouldn't worry unless you have other symptoms or problems. If you are dizzy, nauseous, or have other symptoms, contact your healthcare professional. Please keep a record of your symptoms and when they happen, or call your doctor with your concerns. High blood pressure usually doesn't have any signs you can feel, but over time it can hurt your blood vessels and make them stiff or narrow. This makes it hard for blood flow through the body, including to the penis. When less blood goes to the penis, it can be hard for some men to get or keep an erection. This is called erectile dysfunction, and it is pretty common. Even if it happens just once, it can make a man feel worried. He might even start to avoid sex because he's afraid it will happen again. High blood pressure can also make it harder to ejaculate. Some blood pressure medicines can also lower a man's interest in sex. Some high blood pressure medications can also cause erectile dysfunction. If your blood pressure medicine is causing sexual side effects, talk with your healthcare professional about your options. Some high blood pressure medicines are less likely to cause sexual side effects. Lifestyle changes and/or erectile dysfunction treatments can also help. The best thing to do is talk to your healthcare professional about your options. But it is important to understand that high blood pressure on its own can cause erectile dysfunction. It is not just the medication. Healthcare professionals don't know exactly how high blood pressure affects women's sex lives, but it may reduce blood flow to the vagina. It may also lower something called nitric oxide, which helps muscles relax. This can cause some women to feel less interested in sex, have trouble reaching orgasm, or have vaginal dryness. Using lubricants and finding ways to feel more excited can help. Just like men, women may feel worried or have relationship problems because of these changes. It is important for women to talk to your healthcare professional if you have any concerns. Women with high blood pressure who are planning a pregnancy or are pregnant should talk to their healthcare professionals and be counseled about the benefits of aspirin to reduce the risk of preeclampsia. High blood pressure is the most common reason people get heart disease, including coronary artery disease, heart failure, atrial fibrillation, stroke, dementia, chronic kidney disease, and all-cause mortality. or the total number of deaths from any cause in a defined group of people. The good news is it can be treated and even prevented by making healthy choices, such as eating well, moving your body, and taking medication if it's prescribed. Healthcare professionals want most adults with high blood pressure to keep their blood pressure below 130/80. They may have different goals for people who are sick, older, or pregnant. Check with your healthcare professional if you have any questions. Now it's time for us to move. Let's try a basic shaking exercise for beginners. You can either do this activity standing up or sitting down. If you prefer to stand with your feet about hip width apart, knees slightly bent. Start by gently bouncing up and down, allowing your heels to lift off the ground. As you continue, let the movement travel up through your body. Your legs might start to tremble, and that's perfect. Allow the shaking to move into your hips, torso, arms, and your head. It might feel a bit silly at first, but let's embrace it. This isn't the time for self-consciousness. It's time for release. If you prefer to sit, begin to shake your hands as if you are trying to air dry them. Let the movement travel up your arms all the way to your shoulders. You might find that your hands start to tingle or feel warm. That's a good sign. It means energy is flowing and tension is being released. Now we are at the final part of our presentation, which is all about the next steps through the American Heart Association's Life's Essential 8. These are 8 simple measures that will help keep your heart and brain healthy. 4 are focused on behaviors, and 4 are focused on numbers you need to know. Your blood pressure, cholesterol, weight, and blood sugar are the 4 key numbers you need to know. The 4 key health behaviors are not smoking or vaping, getting adequate sleep, following a healthy diet, and getting enough physical activity. These will be the first ones we focus on. The first step to quitting tobacco and/or nicotine products is to understand the risk and health effects for you and your family. Heart disease. Nicotine and tobacco can raise blood pressure and increase heart rate. It can cause blood vessels to narrow, increasing the risk of heart attacks. Stroke. Nicotine and tobacco can damage blood vessels. It can increase the risk of having a stroke by causing blood clots or blocking blood flow to the brain. It can also cause memory problems and dementia later in life. Diabetes. Nicotine and tobacco can increase the risk of developing type 2 diabetes. For people with diabetes, it can also make it harder to manage blood sugar levels. Cancer. Smoking is the leading cause of cancer. Nicotine can abnormally speed up the growth of new cells. This has been shown in tumor cells in the breast, colon, and lung. Depression and anxiety. Nicotine and tobacco can lead to mood swings and heightened anxiety when their effects wear off. Premature aging. Smoking can cause premature wrinkles, skin damage, or dull complexion due to reduced blood flow and damage to the skin's elasticity. Here are 2 tips for success. Exercise can help you manage the stress and cravings when quitting. You'll feel better too. Recognizing what makes you want to smoke, vape, or use nicotine is key. These include things like stress, certain places, or social situations. Try to avoid or manage these triggers, especially at the beginning. Practice deep breathing exercises to help you calm your body and mind. Slow, deep breaths can reduce stress and cravings. The key takeaway is to get prepared. Start by creating a plan that fits your lifestyle. Set a quit date within the next 7 days. It is best to pick a weekday that does not look like it will be too stressful of a day. Choose a method, cold turkey or gradually. Decide if you need help from a healthcare professional, nicotine replacement, or medicine. Prepare for your quit day by planning how to deal with cravings and urges. Quit on your quit day. Let's talk about sleep. How many hours of sleep do you get on average? Getting a good night's sleep every night is vital to your heart and brain health. Adults should aim for an average of 7 to 9 hours per night. Babies and kids need more depending on their age. Studies show that too little, too much sleep, or restless sleep is linked with heart disease. It is also linked to trouble thinking and remembering as you get older. Your sleep affects your health in the following ways: depression and anxiety, memory loss and dementia, high blood pressure, blood sugar and cholesterol, obesity, heart disease. Sleep problems could be a sign that your brain needs help. Studies show that restless sleep, not getting enough sleep, or sleeping too much may be linked to memory and thinking problems later in life. Waking up frequently during the night could also be a warning sign. Benefits of sleep: better brain function, including alertness, decision-making, focus, learning, memory, reasoning and problem-solving, improved mood and energy, stronger immune system, healing and repairing of cells, tissues, and blood vessels, less risk of chronic disease. Here are 2 tips to get a better night's sleep. Dimming the lights before sleep helps signal to your brain that it is time to wind down. Dim your screen or use a red filter app at night. The bright blue light of most devices can mess with your internal clock and melatonin production, a hormone that regulates sleep. Go to bed and wake up at the same time every day. This helps regulate your body's internal clock and makes it easier to fall asleep and wake up naturally. Set a bedtime alarm to remind you it's time to wrap it up for the night. The key takeaway is better sleep can improve brain function, improve mood, lower the risk of chronic disease, and more. Now let's talk about food. What are some easy ways to add more fruits and vegetables to meals? Eating a well-balanced meal throughout the day can keep your heart and brain working at their best. Don't worry about special foods. A variety of healthy foods is best. Eat vegetables, fruits, whole grains, beans, legumes, nuts, plant-based proteins, and lean animal proteins. Also drink plenty of water throughout the day. Unsweetened tea and coffee can also be enjoyed. Limit sweetened drinks and alcohol. Eat less salty food, fatty foods, and processed meats. Limit foods like butter, whole milk, full-fat yogurt, and cheese. Take the skin off poultry before cooking. Use plant-based oils such as olive, canola, or avocado oil instead of oils such as coconut or palm oil. Avoid trans fats. Trans fats are found in some store-bought baked goods and fried foods. 2 tips for success. Build a healthy plate. Take a picture of this to remind you of what a healthy plate should look like. Reduce the amount of salt you eat. There are plenty of salt substitutes that you can use to keep your food tasting delicious without using so much salt. Salt substitutes can help lower blood pressure. It is also important to read the nutrition facts and labels to keep an eye on package serving sizes. If you need some inspiration, the American Heart Association has hundreds of delicious, affordable recipes. Go to heart.org/recipes to find them. Sodium is part of salt. Ideally, you should eat no more than 2/3 of a teaspoon of salt in total for the day. A lot of prepared foods already come with salt or sodium, which is why it's important to look for low sodium labels, especially in food that is already prepared, canned or frozen. When you eat too much sodium, your body holds on to extra water to balance it out. This adds more fluid to your blood vessels, raising your blood pressure and making your heart work harder. Too much sodium can also lower the effects of some blood pressure medications. Getting more potassium from foods can help lower high blood pressure. Potassium-based salt substitutes can also help prevent or treat high blood pressure, especially for those who use salt mainly in cooking or flavoring at home. Getting more potassium from foods can help lower high blood pressure. But if someone has kidney disease or takes medication that keeps potassium in the body, they may need to be monitored more closely. We all know that moving more is important. The American Heart Association recommends adults should get a weekly total of at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity, or a combination of the two. What is moderate activity and vigorous activity? Moderate activity can include walking, dancing, gardening, and even house cleaning. Vigorous activity can include running, swimming, biking, and jumping rope. The goal is to get your heart pumping. Moving more is essential. Exercise is like a workout for your heart and brain. Getting active, even just going outside for a walk, can help you feel better. It can reduce stress, improve your mood, and help you feel recharged. You can do both moderate and vigorous activity and spread it throughout the week. Try to include activities that also make your muscles stronger at least twice a week. Lifting weights, squats, lunges, and crunches are great examples of strength training exercises. 2 tips for success. Change your mindset. Exercise isn't another to-do on your list. Think of it as a moment you dedicate to yourself to help you unplug, recharge, and clear your mind. Start by making exercise a habit. Do something active every day at about the same time so it becomes a regular habit. Put it on your schedule so you are less likely to miss a day. The key takeaway is to be patient. It can take approximately 2 months to form a habit, so stick with your exercise routine. In addition to lifestyle changes and medications, other stress management activities that may help prevent or treat elevated or high blood pressure include breathing control techniques, yoga, meditation. To wrap up today's presentation, don't forget, controlling your blood pressure is the best way to keep your heart and brain healthy. Most people with high blood pressure don't have symptoms. Talk to your healthcare professional if you have any risk factors. Normal blood pressure is less than 120/80. You have the power to start making small changes today. If you don't know your number, get your blood pressure checked. It only takes a few minutes. You can do it at home, at a local pharmacy, or with your healthcare professional. Start with one small change. Take a moment to think of what it is now. It could be as simple as taking a walk after dinner, setting a bedtime alarm, adding a serving of veggies. Thank you for your time. I hope you enjoyed this presentation. I invite you to keep in touch with the American Heart Association. You can follow them on social media for great, easy-to-follow health tips you can trust.